My name is Thomas Bogdanovich, emerging pharmacist and founder of PharmAssess Diagnostics, where we're building a software tool to help transition pharmacists toward their expanding scope of practice. According to a 2016 Canadian Summit, pharmacists struggle to provide advanced services because they report insufficient time, lack of confidence and support, and competing priorities in the workplace. Pharmacists are overburdened, and coming soon, this is getting worse because Ontario is joining the other 8 Canadian provinces that allow for pharmacists to treat and prescribe for minor ailments, diseases like eczema and urinary tract infections. And so soon in Ontario, people will start going to their nearby pharmacy conveniently and easily to get their minor ailments treated instead of waiting in line at long walk-in clinics. And so despite our excitement towards the profession's evolution, without sufficient support in place to streamline this new diagnostic responsibility, pharmacists will struggle to keep up and take on this advanced clinical service. Until now, because PharmAssess creates a diagnostic software solution that intakes patient information and probes evidence-based resources to enable pharmacists to efficiently and confidently treat these minor ailments. PharmAssess revamps your clinical pharmacy, transforms it to a clinically revamped care center, able to treat these minor ailments faster, more comprehensively, and more accurately. Pharmacists will be more prepared than ever to take on this new exciting opportunity because our software cuts ailment assessment time in half, streamlines treatment selection, monitoring and counseling, even physician referrals, and automates documentation and other administrative tasks like data transfer, and will have a virtual capacity to allow patients to connect in and feed in and get treated virtually remotely at the comfort of their own home. And so this allows pharmacists to be able to treat more patients more efficiently and tap into their unused potential. This allows pharmacists to provide a better relationship with a clinical engagement that improves customer retention and strengthens patient relationships. And more patients with better retention generates more revenue for pharmacies since assessing is a fee for service. To date, there's no software that directly helps pharmacists in this minor ailment process, so we're our first to market. And we really have the competitive edge because we contain all these key elements like automated documentation and assistive interactive prescribing. Our market plan consists of tackling Ontario, 4,400 pharmacies. Next, we're going to expand to the 8 other provinces in Canada, following by penetration to the US market. Now we have an exceptionally strong pharmacy team with 2 licensed pharmacists on board and a provincially renowned pharmacy key opinion leader with 35 years experience in advocacy and pharmacy. We also have a well-established development team to carry out the product as well. We've established a minimum viable product and released it to the early users, and we're currently beta testing with about 50 trial pharmacies, and we're looking to convert those to trial subscriptions as minor ailment legislation changes. And then we're going to engage with a chain pharmacy, nationally expand, and allow penetration to the US. We've received good standing from the LiONS experts and have already implemented KPMG's feedback and established comprehensive financial models, and are working with the legal team at Miller Thomson and Health Canada to ensure product regulation compliance as we expand provincially. Now I'd like to invite you to join us as we revamp and transform clinical pharmacy care in Ontario and across Canada. We have an exciting partnership opportunity that we're hoping to use the LiONS LAIR winnings to fund and execute the deal with Canada's leading pharmacy network that would allow PharmAssess to enter the hands of pharmacists in Ontario and Canada that really need this service. Thank you so much.